welcome to those who have joined this session. My name is Dr. Diane Ashiru-Oredope. I'm a pharmacist, and through this session, I'm going to talk to you about breaking barriers in healthcare. I'm not, the title is interesting for me, and I'm not sure that I would classify myself as breaking barriers, but I definitely have sidelined, stepped over, moved across in terms of barriers. And particularly, I'm going to share with you my journey into public and global health as a pharmacist. And that's particularly unique, and I'll share why shortly. I'm the lead pharmacist for the HC and AMR division of Public Health England, so I have a national role. I'm the global AMR lead for the Commonwealth Pharmacists Association. I'm an honorary lecturer with my alma mater, the School of Pharmacy and the UCL, and I'm also a committee member for the Black Women in Health. So through this session, I will talk to you very briefly about public health and antimicrobial resistance, which are two areas of my passion when it comes to career, my journey into public health and now global health, perceived barriers and what I've learned along the way. And hopefully through my journey, through my conversation with you, you will see how I've been able to step over sideline barriers. So these are the traditional pharmacy careers and I put traditional in inverted commas within the UK. So it's either community, hospital, primary care so community hospital, primary care. So that's pharmacists working in GP practices. That's only very recently become even more common and now actually seen as part of what we do within the pharmacy profession, academia and industry. And interestingly, today, there were some colleagues of mine who presented around the roles of pharmacy, and you can see there, we also have pharmacists in care homes. We have pharmacists who work with remote services, technical services, and public health isn't on there. I'm not blaming them. It's just that it's still quite different for pharmacists to have a key specific role within public health. So just in case you're not aware, and there was a session around public health earlier on today at 10:30. So when the recording's out and if you have more interest in public health, I encourage you to watch that session. But working in public health is really around this. It's a science and art of preventing disease, prolonging life, promoting, protecting, and improving health through the organized efforts of the society. So it's about population health rather than the individual patients in front of you. And there are three domains: health protection and prevention, health and social care, and then health improvement. And you can see the different examples there. Where I tend to work mostly is health protection and prevention, because my core role for the last 10 years has been around antimicrobial resistance. And I'll share some more on that shortly. So these are just some examples of how pharmacy teams contribute to public health. So this is the contributions that we make at a practitioner level, I guess, around smoking cessation, immunization, diabetes, antimicrobial resistance. But for the best part of the last 10 years, my main focus has been around tackling antimicrobial resistance and really contributing to England's activities to tackle AMR, with the aim to reduce the incidence of antimicrobial resistant infections and also to improve our use of antibiotics or antimicrobials. So really a strong focus for mine has been around optimizing antimicrobial medicines, the use of antibiotics, and also improving education, professional education, training, and public engagement. And I've also had a key role around improving access to and use of surveillance data. These are all core aspects within the AMR action plan. I've also been slowly working into supporting tackling AMR at a global level through publications and also through some roles I've had. And I'll come back to this shortly. So I've shared with you my role in terms of antimicrobial resistance in the country, my interest in public health, the fact that I'm passionate about pharmacy, so I'm a pharmacist and love being a pharmacist, and also now global health. And you'll see how this circle comes round when I get to my final slides. A few years ago, in 2014, I led the development of this campaign called the Antibiotic Guardian campaign. And that in itself has been an interesting journey for me. And some of the examples and the tips that I'll share with you later around sidelining barriers and around breaking barriers and around what are the ways in which you can move forward through different challenges that you may have. A lot of that has come from me with developing this campaign and leading it. So when I developed the campaign, it was really for the England or for UK, and it has slowly over time, over the last 6-7 years, now become an international campaign. And you can see through that global map there that we have antibiotic guardians across the whole world. And what antibiotic guardian really is around increasing engagement and interest in tackling antimicrobial resistance. The fact that every single one of us have a role to play in ensuring that we reduce the incidence of resistant infections. In terms of global health, over the last 2 years, I've been supporting or leading the program lead for the Commonwealth Partnerships for Antimicrobial Stewardship. So supporting antimicrobial stewardship interventions. By antimicrobial stewardship, these are basically interventions that we put in place to support good use of antimicrobials. And I've been leading that program across Ghana, Uganda, Tanzania, and Zambia. And it uses a health partnerships approach where pharmacists and other healthcare professionals in the UK work alongside healthcare professionals in those 4 countries. I'm working, my role was CPA, and we work in collaboration with the TEF, which is the Tropical Health Education Trust. So just very quickly to move into barriers. So I did a bit of research. I've got a keen thing about research, and that will come around again when I share about evidence. So I did, what are the perceived barriers? And I use the word perceived because sometimes there are real barriers and sometimes there are perceived barriers. So these are, these 2 sections here are research publications around barriers to women in leadership. And I think that although it's general leadership, it's very much for health as well. So it ranged, there 25 in one research paper and another 15 or so in the other one. You can see that it ranges from age, culture, lack of family or spousal support, gender bias, isolation, lack of flexible working, lack of mentoring, lack of networking. I like this one that was led by the IRC Institute, where it talks about how society expects women to have more family responsibilities. And I would say, and women prioritizing family over work. So for me, those have been quite key barriers for me. So the culture around the fact that I'm expected as the woman to be the main carer for my children. I have 2 children. They are now 11 and 8. So my culture says that that's my responsibility. My parents remind me of that all the time, and just the culture just says that that's my role. And that I'm expected to prioritize my family over work. And I agree with that and I support that, but it's challenging when you want to try and balance both. And I'm very much a person that believes that I want to have both. And there are things around lack of formal programs for women leadership development or providing equal opportunities. So on the left side, I've tried to talk about, for me, where my key challenges come through. And particularly over the last few years, the childcare responsibilities, there was a period of time where that was a major barrier for me. And I guess for a while I said, I'm putting my career at a stagnant level. So I kept just slowly moving up, but it was much slower pace. Lack of confidence isn't so much a challenge for me, but there are times when I do have that, oh, should I really be here? Am I really in the right room? That sort of feeling. Flexible working is interestingly not a barrier for me because I've been very blessed with the organizations I've worked in, and I've also chosen to work in organizations that allow me to have flexible working. And I've been very particular about that right from once I finished university. I remember saying to my PhD supervisor, do you want somebody who comes in 9 to 5 or do you want somebody who delivers? And because he said delivers, I knew he was a supervisor that I could work with. Personal health, that's a challenge sometimes, and I've had periods of times with my personal health where there have been challenges. So that slowed me down a little bit in the number of things that I want to get done. So this is my journey. So I did my pharmacy degree at the University of Bradford. That was my only choice. I wanted to do medicine. I am so glad that I didn't do medicine. But interestingly, when I went to do my work experience, the pharmacist said to me, "Well, you should do pharmacy. You should do pharmacy because it's better for women." And I was so upset and thought, "Why would you say that?" Male, the usual things we say as a young lady who is trying to do something else. But as I say, I have had such a fulfilling career. I have had significant opportunities that I'm so, and I guess again, it's what they say that, things work out for good. And I strongly believe that. And I really don't believe that I would be where I am today if I had done medicine. That's for me personally. Then I did my pre-reg placements, making sure that I had opportunities across both community and hospital, then did a residency at the Oxford Radcliffe hospitals. Then I did my clinical diploma at that point and then went off to do a PhD at the School of Pharmacy. And that's really important. The typical barrier comes in here because whilst I was doing my PhD, I got married and then had a child in the third year of my PhD. Probably not clever, but, I have this strong belief that life has to continue. What I didn't do at that time and I didn't know to do was to specifically ask for maternity leave. I don't think I knew we could do that. This was about 12 years ago. Don't think I knew you could do that. I don't think it was promoted. I think life is different now. So I went through my PhD, I remember King's College London, because I was doing a project there just outside Waterloo Station. I remember throwing up outside the station and just being pregnant and thinking, why am I doing this? But I survived and I got through that period. And then I got through having a brand new baby and writing my thesis. The family support is really important. And I was blessed to be able to have my mum being able to just support me for 2 weeks, because for 2 weeks, I literally lived in the living room and just breastfed the child, handed her back and typed for 2 weeks straight, sleeping in the living room so I could focus on my thesis. Because I didn't ask for maternity leave at that point, meant that I had this deadline to submit. Otherwise, my 3-4 years of the PhD would have been basically, that would have been it. Then I got I went back into hospital, and then there was an opportunity in the Health Protection Agency, as it was called then, and I took it. I applied for the role and got the role and started in the role. Again, just showing the importance of saying yes when you don't, or even when you feel scared. And the reason why I say that is because when I went back into hospital, the picture there with me and the ladies was basically when I worked with the infection prevention team. I was a pharmacist, focused on antimicrobials, but I was very much part of a multidisciplinary team. And when I was asked to take on that role, I'd gone back and I was doing my rotation. I remember thinking, absolutely no way could I do this. And I remember being called down from the ward. And once you get called down, it means that an error has happened. And I was scared that I'd probably killed a patient or something. But they said, well, this role is vacant and we think you can do it. And in my head, I thought, absolutely no way could I do this. It's so high out there. I've only just come back into clinical work. How could I possibly do this at a higher band? But I said, okay, I'm going to give it a go. And so I took it on. And because of that role, that's how I was able to apply for the Health Protection Agency role and started in that role and grew into that role because I was still fairly junior at that point. And then in 2013, Public Health England was created. So remember, at this point, I don't think I knew there was anything about public health pharmacy or not. I just was taking one step at a time. And then whilst I started the role, I then went into and did a master's in public health at the University of Manchester and also took on secondment at Health Education England. So you will see the importance of taking on other roles will come through. Some of the things I've learned over time is the importance of being tenacious. I think it's challenging, I think, as a woman to be able to, especially if you are have caring responsibilities. And I know the men also have caring responsibilities. And for women, for caring responsibilities is not always just about children, because actually life goes in cycles and in seasons. It may be children at one point, and then later on it may be parents, or it could be, a sibling. So caring responsibilities and just being alive and wanting to have a fulfilled life means that you do need to be tenacious. Say yes even when scared. So I talked to you there about being taken on the antimicrobial pharmacist role at the hospital just 6 months after going back into clinical work, after having been out for 4 years doing my PhD. But remember, obviously, I had the clinical diploma. Also, then when I was in Public Health England, I was asked to become the national lead for European Antibiotic Awareness Day. Again, I thought there's no way I could do this, but I said yes and took it on. I encourage the importance of getting a broad range of experience, both within your career and outside of your career. So I definitely have done that for pharmacy and non-pharmacy. So whilst I was at university, I was the Pharmacy Society's IT officer, was public relations officer for the African and Caribbean Society. I was also a radio host. Those skills that I've gained there were very important, have been very important to how I've been able to lead the Antibiotic Guardian campaign, for example. Outside of work, my faith is really important to me. I know how to develop websites again, so I'm able to do some work on the Antibiotic Guardian website and mentoring others in social media. If you're interested in having a family and satisfying career, whatever your standard is, I don't think there's such a thing as a perfect time. You just need to start at some point. But be willing to adapt and continuously learn. Read about writing a CV of failures. I haven't been quite confident to do that yet. So it's really about, those jobs you didn't get, those projects that didn't work out. I talked about medicine for me as an example, or other roles that I hadn't got. If there are people you admire, it's really important. Mentorship is really helpful. And you can have remote mentors. So on social media, I have a list of people that I admire, and I'd love to know more about what they do. And I just stalk their social media accounts. I call them my remote mentors. I learn from what they're posting about. If you haven't read, I encourage you to read Lean In by Sheryl Sandberg. That for me has been a really useful book to read. And about 3 years ago, I really was going to lean out of my national role because it was just getting so much and so overwhelming. But actually the opportunity to talk to somebody else and have mentorship from somebody else who had had a similar experience was really helpful. And I stayed on, and I'm here now. I would say it's important to use your voice and influence, and I'm just going to give a couple of examples. So for me, over the last few years, I've, the National Clinical Fellows, and I've had the opportunity to be able to mentor them, and I learn a lot from them, because actually you can always constantly learn. And I know you're all about to go into your into university possibly, but there will be opportunities for you to remember to mentor and support those students who are coming behind, those A-level students, those students who are about to do their GCSEs. Another point about using your voices, particularly around the fact that I'm a Black woman, I'm a Black pharmacist, and one of the key challenges that has been published so openly is the fact that Black African pharmacy students have had challenges passing the pre-reg exam, and there's so many different reasons to this. But what I decided to do was to start a mentoring group for them, and really just give them opportunity to talk to each other and to really help provide group learning and peer support, and where needed, financial support for mock exams and other things as well. Network and collaborate. This is so important that you do this. And I'm not going to go into the details about how to network, but networking doesn't mean going to meetings and meeting people. There's so many different ways in which you can network, and I really encourage you to find out more about that. But for me, collaboration has been really key. It's because of the collaboration and the support of others that projects where I've had no significant funding, such as the Antibiotic Guardian campaign, have been able to thrive and move forward and collaborate within the organization. So within your school, collaborate, within your university, collaborate, and outside of your university as well, think about how you can collaborate with others. And then think about how you can do that outside of all of that. So for me at the moment, I'm an editor, and I also I'm part of different committees. So remember, as a student, I said I was part of this pharmacy society as an IT officer. So think about opportunities for you to network, to collaborate, and to get into positions where you can use your voice even more, and your voice can count. And you have to start small. So what I often hear is, I want to be the president. There may be opportunity for you to start at a different committee level, and then you slowly work up there. generate and share evidence. So really, as you start your careers and at university, if you're generating evidence through research, do try and publish. I really think it's important because that helps you to be known as a leader or as a lead in a particular area, and it cements your opportunity as being known as a specialist. And those can help to sideline or help you to step over certain barriers, because the evidence is there, and people just, there's, data doesn't lie, is one of the key things I'll say. Knock on doors, seek, ask. I really think that that's really important. At the moment, I talked about my love for pharmacy, my love for public health, the fact that public health and pharmacy is not as common at the moment, probably not common at all. But what I now have over the last 3 months and going into the next 6 months is the opportunity to help shape pharmaceutical public health. And I also now have a new role working with WHO, which for me was going to be in 15 years' time. But, I've had the opportunity now to be able to at least start to work with WHO and see how that goes. I would say that it's important that you understand and embrace the different seasons and of your life, and have the courage and strength to follow through. So for me, when my children were much younger, I was doing my PhD and I was working. For me, and it will differ for different people, my thoughts were that, that's an opportunity for me to progress my career significantly. For some people, they believe they need to wait and get their career to a certain level and then have children. But for me, I did it in a slightly different way. Had my children quite young, and then obviously there was a bit of a lag. But then I then just focused on my career whilst they were still young. But as soon as they go into primary school, where they knew that mommy wouldn't be around, or they want mommy there at school events, then again, I've slowed down for now. And hopefully when they go off to secondary school and university, it'll give me an opportunity again to increase at the pace at which my career is going. Different people have inspired me along the way, so I encourage you to know those who inspire you and those who mentor you. I've been blessed to have awards in recognition of the different roles I've done, again, through sharing, through opportunities that have been provided to me. And I think the importance of sharing your knowledge is important. I've also had the opportunity of giving 2 TEDx talks. I'm going to end with this slide. And when I put this slide on, I didn't know who she was, I didn't know what title to call her, but I'm sure you've all heard the news right now. But, one thing this quote really resonated with me when I saw it. You may be the first to do many things, but make sure you're not the last. And I think that that's what I've been living my life by in terms of, supporting. And whilst, yes, I may have sidelined barriers, but I wanted those barriers to be less for those who are coming, coming, I don't want to say behind me, but for those who are coming forth across pharmacy and in different ways. So I will stop there now, and I will hand over back to the chair.
Many thanks, Dr. Ashiru-Oredope. That was fantastic. Without further ado, just looking at the time, if I could now invite Dr. Imohi to speak. I would not want to. So if that's okay, I'll leave it to you to introduce yourself, and then you can speak to us on breaking barriers in healthcare. Thank you very much.
Thank you for having me. I think I've given this talk already, but I don't know if anyone was at the previous talk before I go on. But I'm happy to give the same talk again. So I'm going to be talking about breaking barriers in healthcare, persisting despite all odds. My name is Dr. Omon Imohi. I'm a general practitioner. I work currently in Merseyside. I was born and I grew up in Nigeria, and I got my first degree from the University of Windsor the Windsor University School of Medicine in St. Kitts. I've done my foundation training and GP training in Mersey faculty. I'm a member of the Royal College of General Practitioners and a diplomate of the Sexual Reproductive Health faculty. I've recently been elected nationally as a council member for the Royal College of GPs, and I'm the founder of Black Women in Health. So I'm going to talk briefly on being a GP. I think it's really important that, whatever you put your mind to do and whatever you decide to go for, that you go for it with the vision and the plan to be your best self. Because if you are your best self, everything else works really fine. So to become a GP, especially if you're an aspiring medic, you need to go through medical school. After medical school, you have to go through the foundation training. And after the foundation training, you go into your specialty training to become a GP. And after your specialty training, you become a GP. Before you become a GP fully, whilst you're in your specialty training, you need to take your exams, which is your applied knowledge test, your clinical exam, and you also have to get your CCT, which is your completion of training certificate. And this then qualifies you to be an independent GP to work independently in the GP practice. There are many routes in GP. Being a GP has afforded me it's allowed me to be able to do many things that I like to do outside of medicine. It's allowed me to be able to be myself. It's allowed me to be able to pursue my other passions, my hobbies, and my dreams. And I think Dale Carnegie said most of the important things in the world has been accomplished by people who kept trying, even where there seems to be no hope. So when I first came to the UK, I faced a lot of cultural differences. I faced a lot of barriers. As a Black woman coming into a culture where I was not used to, I had to learn the culture. I had to learn the system. I had to learn how things work. And in learning how things worked, I was able to build myself up, because in any situation you find yourself, really, it's who you become in that process, growing through it. So it doesn't matter if you've come from abroad. It doesn't matter if you've grown up in the UK, but you've maybe grown up in a family where no one else has been to medical school, or you're the first in your family to get this type of degree or to go through this. It doesn't matter where you've come from. If you put your mind to it, you can get through it. I always say, why blend in when you can stand out? Wherever you find yourself, regardless of if you're a pharmacist, a nurse, a doctor, or any other of the allied healthcare professions, it doesn't matter where you are. It doesn't matter where you are in that career, either at the starting stage, in the middle, or a leader. Wherever you find yourself, stand out if you can. And how do you stand out? You stand out by being the best version of yourself. You stand out by being excellent in what you do. You stand out by being notable with your works, with the things you do with that career. So as a GP, in my day-to-day life as a GP, I see patients. I consult with my patients. I also do administrative works like referring patients to other specialties, reading letters from other specialties to me, looking at blood and test results from any investigations we've done. And most of the time, when you get to that role, when you get to that position, nobody's supervising you because you are an independent practitioner. But you have to keep that spirit of excellence. You have to learn how to keep being the best you, being the best doctor, preventing any harm coming to your patient by making sure that every care you give them is patient-centered and tailored to their needs. And another thing you have to be aware of at this time is always be, aware of your competency levels. In as much as you're trying to stand out, I'm not saying you should do what's be above your competency level, but being able to stand out by going above and beyond, going just that extra mile, doing just something, little. I'll give an example. I was the lead GP at Lee Family Practice, and when I first took over my role there as a lead GP, I found out that we were getting a lot of home visit requests from patients, and home visit is one of those things that we have to do as GPs. I realized that, home visit requests were coming, patients were getting poor end of life care, and more hospital admissions. So I looked into what was the problem at that time, and I looked into how could we solve this. I spoke to the clinical director and I said, can we do ward rounds, weekly ward rounds, where we'll see these patients and be proactive with their care? And with doing the ward rounds, initially we used to get almost between 13 to 20 home visit requests a day. And it was a practice of about 9,000 patients, sorry. I don't know, I'm thinking of pounds, 9,000 patients. And, it was so funny that once we started the ward rounds, the home visit requests significantly dropped. And all we had to do was just a little bit more by giving that ward round every week. Patients going into hospital unnecessarily reduced. Patients' end-of-life care improved. And obviously, we got reduced requests daily for the ward rounds. And that little move we made a significant improvement in the patient's life. And it also helped because I was able to be nominated for GP of the Year, which I won last year, just by the little changes we made. So sometimes it doesn't have to be something big that you have to do. It can be something small. So wherever you are, you can lead from the front, the middle, or behind. It doesn't matter your level. You can make a difference. You have to be a person of impact. Always remember that the difference between a successful person and others is not a lack of strength, it's not a lack of knowledge, it's a lack of will. You have to have that willpower, you have to have that passion to want to do more and be more. And this is a very important question that I think everyone who's an aspiring medic or already in the profession need to ask themselves, what is your why? Because when you know your why, everything else is easy. When you know why you are in this profession, why you want to be in this profession, everything else is very easy. To know your why, just think about that thing that you're passionate about, that thing that you love to do, that thing that the world needs that you have to offer, and that thing that you can actually get paid for as well whilst you're doing it, because of course you'll be paid. So just think of that thing that drives you, pumps you up, motivates you, because your why is so important. Once you know your why, you can bear almost anyhow. You can bear any obstacles on the way. You can break any glass ceilings. You can do more and be more once you know your why. So it's so important to know your why. I told the story of Beethoven before. I'm just going to say it again. He's a German composer who was a defining figure in the history of Western music. Beethoven, everyone knows him. Some people have listened to his music among us. He went completely deaf at the height of his career. And one thing about Beethoven was that despite that he was deaf, no one knew. He continued to compose. He continued to, release music, have shows. And people started to wonder when they found out later that Beethoven actually went deaf around his late 30s/early 40s. That how did he do it? How was he able to continue composing and playing and being his best? His servant said that Beethoven used to put a pencil in his mouth and press it on the piano. And while he was playing, he would feel the vibrations and the sound. Sometimes he would press his ear on the piano. And that was how he was able to continue, because he already knew how music sounded and how it was structured. And he was able to continue. But the main reason was because he knew his why. He knew that he wanted to leave a legacy. He knew he wanted to be his best. So think of your why. Your why is so important. I have to tell this other story. It's Buster Douglas. He was an underdog. And Mike Tyson was the undisputed champion at that time. And Buster Douglas beat Mike Tyson at that game in Tokyo. And everyone asked Buster Douglas, why did you do it? How did this happen? And Buster Douglas said, it was my why. 2 weeks before the fight, his mother died. Before his mother passed away, she told him he will win the fight. His why was to fulfill what he told his mom, that he was going to win that fight. So I believe that within each and every one of us, there's greatness. Within each and every one of us, there's a maestro, there's a conductor, there's someone of power within us. And it doesn't matter in medicine, in our relationships, in our professional lives. You need to discover yourself, discover your why, and have a purpose and a reason that will take you to your destination. Being a GP, there are many routes you can follow. You can either become, a GP working in the practice. You can work in out-of-hours services. You can be a ship doctor, work on a boat. You can be a police, a forensic GP. You can do medical legal things in GP. There are many things you can do in GP, but all boils down to these principles. You must have a vision. You must have a vision. Where do you want to be? Vision is the genesis of all greatness. Whether you want to be great in your career, in your personal life, or in other things you will dabble into whilst you're in medicine, you have to have a vision and dream big. It is free to dream. Release yourself. Don't restrict yourself in dreaming. Again, mindset is so important because our mind controls everything. The thoughts we internalize becomes the words we verbalize. Those become our actions, our habits, results, and outcome. So you need to adopt the mindset of the unstoppable. Adopt a resilience mindset. Adopt a persistent mindset. Adopt the mindset of a winner. because again, in the profession, you need that mindset of positivity to carry on. There will be tough days, there will be tough times, there will be complex patients, but you need that mindset to keep going. You need discipline. You need discipline in the profession. From the level of being a medical student till you get to the end of your career, you need to discipline yourself to be able to go on. You need to discipline yourself to be able to be your best and have a spirit of excellence. Even when no one is watching you, when you are not being appraised, keep being your best. Be the best clinician you can be, do no harm, and just be authentic. And perseverance is the key to victory. Perseverance is the key to all success. Through medical school, you need to persevere. Through the career, you need to persevere. You have to keep learning. You have to keep improving yourself, but keep that spirit of perseverance. Nothing in the world can take the place of persistence. Talent will not. Nothing is more common than unsuccessful men with talent. So even if you do have the talent, even if you do have the skills and the knowledge, you need perseverance. Genius will not. Unrewarded genius is almost a proverb. Education will not. You have to have humanity in you. The world is full of educated derelicts. Persistence and determination alone are omnipotent. Calvin Coolidge. I want to tell you that you are made for greatness. Whatever, specialty you decide to go for, just go for what you think that it's your passion and you want to do. And remember that no matter where you've come from, no matter who you are, who your parents were, you can break those barriers, racial barriers, gender barriers, any type of barriers on your way. You can break those barriers to become who you want to be. The greatest equalizers is hard work and discipline. Hard work and discipline will take you far. So please, I'm here to tell you today to be the best version of yourself, break those barriers, unleash yourself to the world. Remember that you are unique, you're one of a kind, and you're made for greatness. I speak for the whole world and the whole NHS when I say we deeply crave to connect with you. We want you. We need more GPs. We need more doctors, nurses, AMPs, pharmacists. We need you in the profession. So please come with your authentic self. Be in alignment with yourself, stay yourself, be yourself, express yourself, and be fearless in the pursuit of your success because you are limitless. Thank you.
Wow, Dr. Imohi, I am absolutely beaming at the moment, as I'm sure everyone else who is watching this, wherever they are around the country and maybe even abroad is as well. So we've got a couple of questions to both yourself and also yourself, Dan, if you're still around. So one of the questions is from S. Plummer, which was, and feel free to answer, was whether as Black women you feel that you've had to work harder to get the same opportunities as others in your profession.
I think everybody has to work hard. We all have to work hard, and we all need to put our best in. Dr. Imohi just talking about the importance of doing your very best even when nobody's watching you. I think the mindset that we have is really important, and I think that I would really encourage you whilst you're still fairly young to watch the mindset and watch what you think and how you worry about this. And I think that focus on being the best that you can. For me personally, I don't know that I have faced this or have had to work harder purely because I'm a Black woman. That's me personally. But I know for a fact that there are others who have had to go through more challenges because of that. But it may also be because growing up, my dad just said, you can do whatever you want to do. It doesn't matter what you look like as well. So that in my head has always been there. So I think I'm going to pass on to Dr. Imohi because I said everybody has a different experience of this. I have had to work hard, and I work hard all the time. But that's because I'm passionate about what I do.
Thank you for that, Diane. For me, I'm going to disagree a bit with you, and I'll agree in some things as well.
And that's why I said everyone has a different opinion on this.
Yeah, exactly. For me, I'm going to speak for myself, and I think I'm speaking generally as well when I say this, that I think a lot of Black women have to work harder. being Black already puts you at a disadvantage. It's I don't really want to say this, but it's the truth. The truth is bitter. Being Black puts you at a disadvantage. Being a female adds another disadvantage to that. But like Diane has said, it comes to who you are. It comes to your mindset. That's why I think mindset is something that's so important. I think everyone going into medicine, especially if you're from a BAME background, if you're from a deprived, community, even if you're white, you need to go in with that mindset that you are unique. You are also deserving of this role. You are also deserving to be in this profession. The profession is not for a selected few. Like I said, hard work and discipline are the greatest equalizer. If you go in with that mindset that even if anyone says I have to work harder, yes, I will work harder. I will work harder. I will grind. I will hustle, and I will get there. For me, I've had to work harder. I've had to work harder to get to where I am now. And, I think once you have the works to show for it, nobody can argue with that. Coming from an African background, I came to the UK as an adult. So already when I came, it was difficult for me. I had, times I had to learn how to fine-tune my accent so people could understand me better. I had to learn the lingo. I had to learn more things. There were times when I was not included in things that I really wanted to be included in, and I felt left out, and I had to prove myself even more for certain things. So for me, I think as a Black lady, you will have to work harder, but don't let that stop you. Remember when I was preparing for my GP final exam, there was this thing about, Black and BAME doctors tend to fail these exams. But I went there with a different mindset. And I always tell people this: don't let what anybody tell you about their experience hold you back. I went with the mindset that, yes, they've said Black and BAME doctors always fail these exams, but I'm going to pass it. I'm going to make it the first sitting, and I did. So I'm encouraging you that even if you've heard many times, even if I'm saying it that you have to work harder, don't let that be your reality. Do the work, but don't portray it out to anyone else. Don't think anyone else is out to get you. Go in with an open mind and a growth mindset, because in the process of working harder, you become a better person. You become more knowledgeable, and you become more experienced as well. So, yeah.
Another question which has just popped in. So just realizing that a lot of we have a lot of students today, and a lot of them, apart from looking at medicine, we also have students from other allied health professions. So we have a question from Emilade Ayontoye, and I believe this is posed to yourself, Dan. What initially made you interested in pharmacy?
Gosh, can I remember? I'm not quite sure what the connection. As I said, I think from as a nature, what I wanted to do was medicine. That was I wanted to be a doctor. Don't know if it was because that's what you do. You're the doctor, an accountant, or a lawyer, maybe. But I think I became interested in pharmacy as I got into as I started doing more sciences and I got into chemistry. I think that's where my interest came in. And as I said, I did the work experience within a pharmacy setting as well. And so that gave me the opportunity. And also, I realized that as a pharmacist at that time, you had the opportunity to work in a hospital and still care for patients in the same way. Well, not quite the same way, but you could work in a hospital and have a clinical role, which is where my passion for clinical pharmacy started for. So even though I went off to do a PhD that was more geared for industry, I went straight back into hospital care. So for me, there were the two options that I considered at the point of submitting my application for university. So, and as I said, I have had the opportunity to do so much more and have had a very fulfilling career through pharmacy.
Cool. Another question that we have is whether there have been any particular challenges or any particular difficult moments where you've wanted to give up in either of your careers. And if so, how did you... apologies, this is quite a personal question, but how did you overcome this and how did you persevere?
I'll let Dr. Moyi go first and then I'll share mine. I have two.
Yeah, I think two times were really hard for me. One was even before I got into the career. So this might be helpful for any aspiring medic out there. My first one was when I was doing my GCSE. I failed my chemistry, so I didn't have chemistry. And for someone who wanted to study, at that time, I wanted to study pharmacy or medicine. It was a limitation for me. It was like, no way. So I was really feeling bad. I went home. I was crying. My dad had to tell me few things. He said, you are not a failure. Don't let this moment define you. You can do better. And if it doesn't work, you can be anything else. So he bought me a few books. I always say this story. Sorry if it's boring, but he bought me 2 books. One of them was Tough Times Never Last by Robert Squella, and one of them was Gifted Hands by Ben Carson. I read Gifted Hand by Ben Carson, and it changed my life. That book was about Ben Carson as a young boy who was doing poorly in school, and then his mom, kind of built him up, spoke to him, motivated him, made him read books, and he became like one of the best students. And it was a time of severe prejudice in America, and he went on to become the first Black pediatric neurosurgeon at the age of 33. And even though sometimes patients didn't want to see him, and if they asked for the doctor, he would come out, he was a Black doctor, and they'll be like, no, they thought he was a white man. And he thrived through that. So for me, after reading that book, I was so challenged, and I said, I must be a doctor. So that pushed me to do better, and I passed my chemistry the next time, and I go into medical school. So the moral lesson from that is that failure will come. It's part of the process. Don't let it knock you down. It doesn't define you. Keep up, get up, dust yourself, try again, and move on. The second time I really had a very difficult time was during my GP training. I was already, towards the end of my GP training, but I was having a very difficult time with my clinical supervisor, who was kind of, I don't know if it was cultural, misunderstanding, or if he was biased, but he gave me a very tough time. And it was a very difficult time for me. I didn't think of quitting. I challenged him. I challenged him instead. I learned initially, I was just taking it and keeping quiet. But after a while, I learned I had to be assertive. I had to learn how to stand for myself. And the good thing about that was that for both of us, it became a learning process. He learned from me. He learned from my responses. And I also learned more about myself and about how to, challenge mindsets like that, challenge behaviors that are unacceptable in the career. And through that process, he learned. And like Diane said before, when she talked about Kamala Harris, it's not about you sometimes, it's about the people coming behind you. I'm very passionate about representation. And I'm very happy I stood up during those times, because the other trainees that came after me had a better time. He understood and knew how to deal with them better after then. And he actually used to tell them that, oh my gosh, I was really difficult on her, and she taught me how to, and now I'm a very good trainer. I understand how to deal with you. So sometimes when you see things going through hard times, especially when it has to be with discrimination, harassment, bullying, speak out, because if not just for you, it won't happen to someone else. Thank you.
Off mute. So for me, there are 3 things actually. So doing a PhD. Doing a PhD is not about being clever. It's the tenacity. So that was 4 years, and then particularly deciding to have a child. So I had a miscarriage, didn't get over it, but I had a miscarriage and then had my first child. So trying to go through that whilst doing a PhD was what got me through. And it's a theme that I'll run throughout. I would say my faith. I would say my mindset. Just believing that you can do it and taking one step at a time. Connections and the people that you connect with, because they will support you through it. And even if you don't have support system, just trying to work through that mindset. And I would really encourage that mindset is built from as soon as possible. It's really important that you focus on the things that you can do, and not what other people perceive is the challenge or what other people say is going on in the society. So that my PhD. Then another one was a horrible time at work, and it involved individuals and my line managers. And actually, I could possibly have thought maybe this is racial, but at that point, I wasn't thinking about that. I was just thinking, this is a horrible person making my life difficult and making the life of the team difficult. I don't know how I stood through that one, I would have to say, but one of the things that kept going through my mind was that If I'm going to become a lead, even more of a leader, as I'm getting into higher leadership positions, then it's important to face challenges like this, because it will help me in how I support others. So sometimes seeing those challenges as opportunities to learn can really be helpful. And then whilst it's very painful through that process, just think about what are the things that you're learning out of this, the challenging time. The last one was when I was going to lean out. And for me, that was really around the fact that I had young children, I have a national role, and I was just struggling to cope. I was really struggling to cope. And what's helped me at that time was reaching out to somebody else who had been in a national role. Because one of the challenges with being in a national role is you can't just go talk to anybody, sadly, because they may not understand, or also because you don't want to seem like you are... The information you have available it needs to be in a closed circle. So it was really challenging, but I was lucky that I was able to find another lady who had been in a national role who could support me through that. So finding people that you can talk to, and the person I reached out to her through social media in the first instance. So goes back again to building connections over time. So those are three particular instances that I remember.
No, thank you very much to you both for sharing what's obviously quite personal experiences. So two related questions. One from Cambright Tianfield, I believe directed towards yourself, Dr. Mohi. How long did it take you to find your why? And also another related question from Christine Sequeira, in the sense that what your motivations were for you both, and if there's any, and if you could go back, is there anything that you would change or do differently regarding your paths?
Thank you for that question. I think it's a very good question. How long did it take me to find my why? I actually thought I found my why when I read the Ben Carson book, Gifted Hands, and I got into medical school. But that was not when I found my why. When I really found my why was when I became a doctor, when I was actually practicing as a doctor. I finished my foundation year and I started my GP training. And during my GP training, that was when I realized the real reasons why I was doing the things I was doing. So professionally, I really, really wanted to make a difference in my patient's life. I really wanted to be the best doctor that I could be. And there was one incident where I was sitting with a patient, and this patient came to see me and he was devastated because he was 40 years old. He had just lost his business and he didn't go to college or university. And he was just saying to me, "Oh, doctor, I don't know what to do. My life is over. I don't know where to start from. I don't know. Everything is finished. I just need a sick note now to start claiming benefits." And at that moment in time, I dropped my heart as a GP trainee I was then. And I said, "It's not over for you. It's not over. 40s, I just jokingly said 40 is the new 20. So it's not over for you. You can be anything you want to be. You can do anything you want to do. I know you've said you've not gone to college, but you can go back to learn. You can go back to re-educate yourself. And there are a lot of things you can do now. There's social media. We didn't even have this much social media then, but there's social media. You can sell online. You can learn a new trade. You can learn new things. And we had a chat, and I gave him some examples like, KFC, Colonel Sanders, he got it after the age of 60. J.K. Rowling, she was rejected many times. And I just gave some examples like that. And my patient went and he came back for a review 2 weeks later, and he was looking a lot better. He was more positive in himself. And then I saw him again after 4 weeks. That was 6 weeks from when we initially spoke. And this time he said, "Doctor, I'm so excited. I've started a new business. My friend helped me and I learned about car sales. And now he had opened a car sales shop." And he was really excited. And at that moment in time, immediately left my office. I was like, that is my why. That is my purpose. That is why I am who I am. That is why I'm in the position where I am. Because in GP, especially in medicine generally, might be the same, but specifically in GP, we don't just deal with the medical aspects of a patient, we deal with the socioeconomic aspect. Some of our patients come in, they're homeless. Some come in, they need food. Some come in, they've got no money, they've lost their jobs, especially in unprecedented times like we've had this year. We have a lot of patients that don't have physical illness, but they just need someone to talk to. They just need some encouragement. And at that moment, I realized that I just wanted to be the best doctor I could be and offer help in every way that is possible for me to make my patient's life better and support them in the way I can. And for me, that was when I discovered it. So, and many times you will discover many, you don't have just one purpose. But one thing I want you to know is that your purpose or your purposes in life is tied to other people's lives. It's tied to other people's destiny. Other people's destiny, rather, is tied to your purpose. It's not for you. Your reason for being a doctor is not for you. It's not to be called Dr. Imohi or to make money or, for that prestigious name. It's to make a difference. You have to be a person of value. You have to create solutions to problems. That's on this. Once you know your why, you will see that your why is to create, value and to be a solution to other people's problems. And the day you find it, you will know. It's not something that's hidden. It's within you, but the day it comes out, you will see it. You would know. Oh, sorry. And you asked what motivated me. What motivates me? Oh my gosh. What motivates me? It's being able to make a difference. To me, legacy is being able to impact lives. The moment I can see that, in fact, let me just give you an example. I had a patient one time and she came to see me with very high, sky-high blood pressure. And we started to work on bringing her blood pressure down. She was compliant with the medications. By the time I got to the 4th medication, I was worried. I was saying, oh my God, how are we going to do this? I just told her I'm starting the 4th blood pressure medication. This was over months. And the next time she came to me, her blood pressure was down. And when I did her blood pressure, I jumped up and I was dancing. And she was like, oh, doctor, you're happier than me. And I was like, yes, I'm so happy seeing you well, seeing that the medication is working makes me happy. So I think what motivates me is seeing change, seeing, positive change in the health of my patients, seeing them happy, seeing them well. And for me, another thing that motivates me is when I see people, especially women, I'm passionate about women of excellence, doing well, making moves, changing the stereotypes, changing the narrative. Those things make me want to do more and be more. Thank you. And if there's anything I would change, I don't think I'll change anything. I don't think I'll change anything in my path. I think I will probably do more, but I won't take anything out. Thank you. You're mute.
Sorry. Yeah, I wouldn't change anything either. The twists and turns, the challenges are all part of who have made me who I am today. And in terms of what motivates me, I think I'm very similar to Dr. Moy, is that it's making a difference. It's seeing people's lives change. So for me, the pre-reg pharmacists for me have become a particular group that I'm trying to focus on, and using my voice is a privilege and an honor that I don't take lightly. So for me, it's that opportunity to use my voice is really important. I'll stop there.
Many thanks. So I think we're coming up towards the end of our session, and I can't see any more questions. So I'll just finish on one personal question that I have. So as I said, we have a lot of students joining us today, a lot of whom are at the very beginning of their careers. Unfortunately, we don't have a time machine in real life. However, if you were able to go back and speak to either your 14, 15 or 16-year-old yourself, if you can imagine them now, what would you say to them? What bits of advice would you give? And I think we'll close it after that.
Me, the first thing I'll tell myself is still take it easy. Life is meant for living. So even as you're going through the journey, enjoy it. Enjoy the journey, because human beings, we should be all-rounded. You should make sure you have a life outside medicine. So I'll tell myself, just relax. Everything will be fine. Everything will work out well. And the other thing I'll tell myself is, number 2, don't compare yourself to anyone. This journey is individual journey. It's just about you. Focus on you. Focus on what you have within you. And finally, what I'm going to tell myself is something I learned over the past few years. You must know your 5 W's. I'm not going to go deep into it. Sorry, I know I talk too much, but I won't go deep into it. Know your 5 W's as you grow. Number 1 is your identity. Who are you? Know your identity. If you don't know who you are, people will tell you who you are, and that won't be you. Don't try to be like anyone else. Don't try to talk like anyone or do what anyone is doing. Know your identity. Number 2, where are you from? That's your spiritual source. For me, I'm a Christian, so know your source. Number 3, why are you here? What is your purpose? Know why you're here. Even if you don't know it now, it might not come immediately. Keep searching for that purpose, and you will find it in the things that are already within you. And what is your potential? What can you do? What are you capable of doing? Don't let anyone tell you you are average and that's all you can do. That's the only level you can get to. And finally, what's the outcome you're looking for? Once you know the outcome you're looking for, you will know all the steps you need to take, or you'll be able to plan all the steps you need to take to get there. But take it easy, enjoy the journey, because it's a marathon, it's not a sprint. Thank you.
And for me, I think it will be similar in the sense of, take one step at a time. Life is a journey. And I will go back again to, if there's something I know has been helpful for me, it comes back to that mindset and your belief system, and the importance of guarding your mind, guarding your heart, so that actually when other things are happening around you, you can remain as strong and as stable as you can.
Very well said. Very well said, both of you. So I think we're going to close there. So thank you very much, Dr. Imohi and also Dr. Ashiru-Oredope, for giving up your Saturdays to speak to us and to speak to our students. I, for one, can say that I found that very, very inspiring. And thank you also for sharing quite personal experiences in terms of challenges and experiences that you've both had. If there's any, if any of our students want to sort of follow you on social media, feel free to drop your handles in the session chat, or give a link to any of your websites. And thank you everyone for joining us this evening as well. And with that, I will bring the session here to a close. And thank you once again to our esteemed speakers.
Moderation. Thank you.
Thank you for having us. Thank you.